Okay, now coming on to the next question. In fact, these are basically some research, the next 2-3 questions I'm going to discuss is based on some research concepts, okay, or research findings, which is directly being picked from your Cohen. So, and yes, you might get some questions because it is directly picked from Cohen. Now, which are the following agents used in revascularization? Now, see, you can find a little, controversial, and that's why I've included this particular question here. Which of the following agents is used as in revascularization and showed a significant increase in root dimensions? Mean to say, root lengthening, root thickness, all those. Okay. Now, naturally, we all have a tendency to go for MTA, isn't it? Or MTA with any other thing. But in fact, here the answer is answer B, triple antibiotic paste. Now, in our initial lectures, I already told you, for disinfecting the root canals, for revascularization, the major agent being used is your triple antibiotic paste. Okay, and so the answer here, which is given in your book, that is Cohen, direct reference, and it is even quoting a journal there, and it says that triple antibiotic paste and calcium hydroxide showed significant increase in root length and the wall thickness. Okay, basically what you want here in regenerative ortho, like endodontics, you want your root length to increase and also the wall thickness of your dentine. So this is was fine with these two. It doesn't mean that MTA didn't show or but yeah, MTA also had, for even formocrosol showed it. And what is basically NSRCT? It is non-surgical root canal treatment. Okay, so basically there was a study conducted which shows the best results, and it was found that triple antibiotic paste and calcium hydroxide showed the best results. Okay, now coming on to the next question. So again taken directly from your Cohen, which statement best describes the instrumentation approach in endodontic revascularization? Now, few things which differs in your typical non-surgical root canal treatment or your typical root canal treatment. There we have, you all know that basically what we do biomechanical preparation, or to be specific, chemomechanical. That is, you use saline or hypochlorite, and definitely you do a good bit of instrumentation, isn't it? So that's chemomechanical, okay, in your conventional method. But if you see here, you don't do too much, or you do a minimal instrumentation. So in revascularization, the instrumentation is minimal, and basically we follow a chemical, not chemomechanical. We follow a chemical methodology for your preparation. Okay, chemical, or more specifically for your disinfection, and minimal instrumentation. So what is being used for as a disinfectant? Basically, as I've told you, triple antibiotic paste. Okay, triple antibiotic paste, and it's been combined with sodium hypochlorite, and this is being kept in the root canal for a few days or few weeks, and then that is sufficient to produce a chemical disinfection instead of going for a biomechanical. That's what I'm saying. So basically what we have here is a minimal instrumentation. Okay, minimal or no instrumentation of the dentinal walls. Basically we disinfect it, and I told you already the next big concept is your blood clot formation, okay, which I've already discussed in the previous questions. Okay, so that's the thing here. And yeah, why minimal instrumentation? Basically your book says the biggest problem if you do too much of instrumentation is your smear layer formation. You all know that, isn't it? Your smear layer, and this smear layer basically makes or impedes your regenerative process. Okay, you need your stem cells to come, you need your blood flow to act as a even providing some growth factors. Okay, so this is not, or this will be impeded if there is a smear layer. Now coming on to the next question. Yeah, again it's taken from your Cohen. how long after revascularization is a radiographic evaluation of root development recommended? So when do you evaluate if your radiographic lengthening, when do you first evaluate? That's a question. That if your root formation has proceeded and root length has increased, like you do it in your apexification and all, isn't it? So here your book says, again your Cohen says it's 12 to 18 months, okay, at the earliest, okay, that is as early as 12 to 18 months, and sometimes you should go till 36 months, but as early as, no, if you want to do it at the earliest possible, don't do it before 12 months. So that is 12 to 18 months, okay. So that's it for the questions on regenerative endodontics. Please refer back to all the questions and make sure that you're doing it well, because yeah, you'll get a lot of questions in your upcoming exams also, including your mock exams on regenerative endodontics, because this is one of the very recent questions being asked, okay. Based on this, there has been some questions. That's the reason we have discussed almost everything which is important for you, okay.